Before I introduce our speaker, I just want to give you a little housekeeping issue. We will have a Q&A period right after the talk, so please submit your questions using the Q&A feature of Zoom, not the chat. So today, I'm really pleased to welcome Timothy Caulfield. He's the Canada Research Chair in Health Law and Policy, professor in the Faculty of Law and School of Public Health, and the Research Director of the Health Law Institute at the University of Alberta in Canada. Professor Caulfield was originally scheduled to join us for National Public Health Week last April, but because of the pandemic, which tragically continues to rage, we had to reschedule. So I'm really excited that he's now able to be with us, albeit on Zoom. Professor Caulfield has been on the faculty at the University of Alberta for more than 20 years. He served as visiting professor or scholar at a number of universities around the world. He's published over 350 academic articles on topics such as stem cells, research ethics, public health policy, and the public representations of science. And he's earned multiple academic and writing awards, as well as recognition as a fellow of the Royal Society of Canada, the Canadian Academy of Health Sciences, and the Trudeau Foundation, where he's leading a project mapping the scope and nature of misinformation in the context of COVID-19. In addition to his academic work, he's a frequent contributor to the popular press. He debunks the myths, the pseudoscientific approaches to health and wellness. His books, which are very creatively titled, are The Cure for Everything, Untangling the Twisted Messages about Health, Fitness, and Happiness, and Is Gwyneth Paltrow Wrong About Everything? When Celebrity Culture and Science Clash. And these have become national bestsellers. His next book is titled Relax, Damn It, A User's Guide to the Age of Anxiety, and it's slated for release next month. Professor Caulfield is also the host and co-producer of the award-winning documentary TV show, A User's Guide to Cheating Death. He has established himself as a preeminent expert on the impact of pop culture on health behaviors. I think as the coronavirus pandemic has demonstrated, public disinformation and the mistrust of science is an epidemic in and of itself, and it can and really is endangering the public's health. Whether we're discussing the efficacy of mask wearing or who won the race for president, false information has become an incredibly real and systemic problem in American culture. Professor Caulfield has dedicated himself to debunking pervasive myths, and I think we should pay really close attention to his approach to effectively communicating sound evidence-based science for our own research and practice. So now it's really my pleasure to welcome Professor Caulfield.
Thank you. Thank you so much for that very, very kind, too kind introduction. And thank you for this invitation. You know, I wish so bad. I love Philadelphia, you guys. I really do. A little bit more this week than before. I'm sure you guys are sick of hearing that, but I genuinely mean that. So I do wish I could be there with you guys. But I hope you enjoy this presentation. And it really is about something that I feel passionate about, and that is fighting misinformation. And as noted, I totally agree. This is an international problem. You know, I've been studying this for decades, and I've never seen anything like this. Even when we got our grant to study COVID misinformation, we got it right out of the blocks in February. I did not anticipate it was going to be this bad. I really didn't. It has become, as the World Health Organization has noted, truly an infodemic. So what I want to do today, I want to take you through some of that noise, and you guys know this, but it's good to remind ourselves where we are, how bad it's gotten. I want to talk about the impact that it has, and again, you guys know this, but again, good to remind ourselves about it. And I do want to, dive into some of the complexities, why people are believing this. But more than anything, I want to talk about the good messaging, how we can debunk this, how we can respond, because I really believe it's important, especially for people like you guys, people, experts. I believe debunking can work, and I'm gonna make that argument. So let's forge ahead here, you guys, and remind ourselves how bad it's gotten. That there really is an incredible amount of noise out there. This is a headline from April, and even then, there was talk about cow urine as a cure, bleach as a cure. There's all these other suggestions about where it's come from. And really early days, the World Health Organization coined this term, this that it's an infodemic. And I think that's absolutely correct. This is having a measurable, tangible impact on how we respond to this public health crisis. And the misinformation is coming from everywhere. Of course, I have to mention Donald Trump, and I'm going to mention him again in a bit. But you get it. You get misinformation like this. In fact, misinformation has almost become the norm, right? And that's one of the reasons it's become so difficult to fight it. You have misinformation like this, saying that it's we shouldn't be afraid, that he feels great, and there's even subtle misinformation about the drugs that he has taken in order to respond to his illness. So the misinformation is absolutely everywhere. And there's some evidence. I'm going to talk about this later, and the robustness of this evidence. I think we need to be careful because it's hard to study this well. But there's some indication that this misinformation is also having an impact on our well-being. This was a study. Maybe you guys saw this. Suggesting that happiness in America, for a bunch of reasons, but no doubt COVID is a big part of this, has dipped to a 5-decade low. Similar data here in Canada. This is actually a colleague at the University of Alberta did this work. Similar data. People are feeling stressed out. So this matters. This misinformation matters. So I do want to talk about the impact misinformation is having on our stress levels and our anxiety. I hope that you find this presentation useful for you as professionally and also as an information consumer. But as I said at the start, they're really as an individual, because I want to empower you and hopefully inspire you just a little bit to become part of the sort of the team that needs to respond to this misinformation. So let's get started. Let's talk a little bit about, remind yourselves how crazy it's gotten. There's misinformation about absolutely everything. As I said, there's misinformation about the source, and one of the most interesting ones, personally, I think, is this idea, this 5G conspiracy theory, the idea that 5G technology caused the pandemic. I find this one fascinating because it's not even scientifically plausible. What's the mechanism of action there? But you have that kind of conspiracy theory. Of course, you have the conspiracy theories around the idea that it's a bioweapon. You have crazy scientific ideas like it's come from a comet. I don't know if you guys have heard that one. That one's getting a little bit more traction right now. And the other thing that's going on, and I'm sure everyone here has noted this, is the way that long-standing conspiracy theories have been nuanced and converted to fit the existing narrative. And one of the best examples of that, of course, is the idea that this entire thing is a big pharma scam. So that transition, something that we're looking at the institute. The common conspiracy theories are being used to explain the COVID crisis. In fact, I'm almost certain that COVID-19 came from the grassy knoll, right? In fact, that tree kind of looks a little bit like the virus. So you heard it from me. But look, these things are really these ideas they seem extreme. But if you look at the data, and again, we need to be careful how we're interpreting this survey data. But if you look at the data, people are believing it. This is a study, relatively early days, that found, a fifth of the population in the UK thinks it's a full-on hoax. The COVID is a full-on hoax. Lots of data from the US, as you guys know. This is one from Pew. Again, relatively early days, and the numbers have gotten worse since then. We have 3 in 10 Americans believing it was made in a lab. I find this one absolutely fascinating. And again, we need to be careful. Don't overinterpret the surveys, Tim, but still, I find it fascinating where you have only 1 in 4 Republicans disbelieving the Bill Gates coronavirus conspiracy theory. And I find this one really amazing because as you guys know, the Bill Gates conspiracy theory, that's a hardcore conspiracy theory. This is this idea that, Bill Gates created the pandemic so he could vaccinate people, so he could put microchips in us and monitor our behavior. Hardcore, right? Hardcore. But look at this. 28% of Americans believe that conspiracy theory. Now, the depth of the belief, I think we need to be careful, but a lot of people are at least willing to believe it. Here's a study that came out again, not that long ago, where you find about half of the adults in the United States believe one of the big conspiracy theories, and you drill down, you see the acceptance of misinformation about particular things being really scary, like the idea that masks are harmful or that hydroxychloroquine works. These beliefs are there, and there's a pretty robust body of evidence to back this up. What about Canada? What's happening in Canada? It's bad here too, you guys. It really is. Of course, we get a lot of your news, we get a lot of your media, but you have, this was a study done by a colleague of mine, Josh Greenberg at Carleton, and Josh and his colleagues found about half of Canadians believe, at least again, one of the big COVID conspiracy theories, and it was actually 46%. So the numbers aren't great. And just to give you an example of what Canadians are believing, you have like 26% of Canadians believing the bioweapon conspiracy theory. And that's really a high number. And one of the things that's interesting about this for me is in Canada, we don't really have the same political kind of rationale for the circulation of this conspiracy theory. But despite that, because that conspiracy theory is in the ether, we still have these high numbers in Canada. And you can see that one of the things interesting by this study is you see that younger demographic, the 18 to 29%, you see that there's even a higher level of belief. Now, Josh and his colleagues think that, that's not because that demographic's dumber, that they don't have the same critical thinking skills. It's because they're exposed to it more, right? This is a social media phenomenon, which I'm going to come back to. I thought you guys might be interested in this uniquely Canadian conspiracy theory. This one, quite recent, started just last month, really just weeks ago. And this is a belief that COVID, or that the Health Canada, the federal government, is creating internment camps, concentration camps. That phrase has actually been used in association with this conspiracy theory in order to force people to quarantine. And this is really fascinating because we've been able to follow and sort of watch this conspiracy theory blossom. And the good news is, this is also an example of how you fight conspiracy theories, because the Public Health Agency of Canada got right on top of it as it started to blossom, and I think have done a good job stopping it. But we have our own conspiracy theories too, uniquely Canadian, eh? So where is this coming from? And again, you guys know this, but good to go over the data. This really is a social media phenomenon, not entirely, but it really is. And we've been studying this, as I said, for decades. And when we got our grant, we actually kind of hypothesized that traditional sources of news media were part of the problem too. And we have definitely seen that in other domains, before COVID, how the traditional news media reports health is not always ideal, right? And so we kind of anticipated there was going to be a problem here, and we were wrong. In fact, we've decided not to study those sources, because pretty early days, the conventional sources of news media, they got it right. They recognized that, not entirely, not ideal, but pretty well, they got it right? They recognize this was a big issue, and the reporting's been fairly balanced, right? But other studies have shown that it really is a social media phenomenon. This was a study that came out of McGill, and again, we have to be careful about correlation causation, chicken and egg, and also no surprise, right from this headline. But colleagues worked on this project, and they found Twitter and Facebook, people who get their news from Twitter and Facebook, more likely to be misinformed. No surprise, right? But other, body of evidence is starting to emerge around this. I think that we can, not surprising, but we can start really believe it. This is another study again from the United States. They really point their finger at Facebook, and I think this one was interesting. One of the nice things about social media research, and we do a lot of this ourselves, is that you can get a huge N, right? You can really dig down into what's going on. What they did here is they looked at over 7,000 bits of misinformation, and they found that over 4,000 of those bits of misinformation had as their origin Facebook, right? So they really, they point their finger at Facebook. One of the other interesting things about this being a social media phenomenon is the impact that bombardment of information is having on our psyche, right? And there is some indication, again, always the caveat, hard to study this well, that it is stressing us out. It's freaking us out, right? This, coronavirus overload, particularly when that information comes from social media. So this was a study that came out in September. I'm going to be saying this phrase a lot. So no surprise, being exposed to pandemic news and conflicting information is a predictor of being stressed out. All right. And that, there's again, a body of evidence, starting to emerge around that. This is another study that found that, particularly if you get your information from social media, more likely correlated with mental health issues. And there's also some interesting research emerging around the impact that stress and fear has on our tendency to share misinformation. So that this is creating a really kind of worst case scenario, right? Around the spread of misinformation in this space. Now, there's a lot of really interesting research going on around, why people believe this stuff. Why are conspiracy theories getting so much traction here? And people are probably familiar with some of these things. The idea of, when there's times of uncertainty, people want narratives that give them a complete picture of what's going on. They want stories that fit with their pre-existing beliefs. There's a whole bunch of interesting research around that. And there's also this idea that some people are psychologically predisposed to believe conspiracy theories. But the reason I put this headline up is they quote one of our colleagues on our grant, Gordon Pennycook. He's at the University of Regina, and he's a psychologist doing actually research on why people believe this stuff. But this quote is really interesting because his work highlights when people are stressed out, when they're fearful, this distracts them from making judgments about the content they're getting, right? Okay, so let's put this all together, you guys. You can now sort of see this worst case scenario kind of starting to take shape, right? You have social media spreading misinformation, heightening fear, heightening stress. That fear and confusion may, I think we need more research on this, reduce our ability to make judgments about that content, and also increases the likelihood that we're going to share that misinformation. So around and around it goes, right? Really kind of terrible situation. We need to figure out how we can break that cycle. And I've got a few ideas that I'm going to come to at the end. Okay, so another source of misinformation. David's right. I'm sorry, Laura's right. I'm very interested in celebrity culture and pop culture, and so this is something I've studied for a long time. And yes, celebs and prominent individuals are playing a big role here. Woody Harrelson, I don't know if you guys knew this. Woody Harrelson was one of the epicenters of the 5G conspiracy theory. Did you guys know that? He really did play a role in spreading this misinformation. And celebrities and wellness gurus have also spread misinformation about cures, which I'll come to in a moment. But I think the important thing to highlight here is the role of the prominent individuals. Now, this is a really interesting study that was done at Oxford. And what they did is they looked at hundreds of bits of misinformation, things that were circulating in pop culture that had already been proven to be wrong. And what they found was that 20% of those bits of misinformation had as their source a prominent individual, which is pretty high, right, in itself, pretty high. But look at the next number. 69% of what's circulating in pop culture on social media about misinformation is us sharing the stuff from the prominent individuals, right? So I think that's really important because that highlights that it's both a top-down and bottom-up phenomenon, which also speaks to how we might want to stop the spread, right? So I'll come back to that at the end. Remember this study, right? I think it's really important. And then there's this study, right? This one was quite recent, and you guys probably are aware of this one. It got a lot of news. This is that study, which I still think is a preprint, but it's done by a terrific group at Cornell, I believe, where they found, and they looked at millions of bits of misinformation, or a million bits of information. They sampled it down to, I think, 1.1 bits of misinformation that were on both traditional sources of media and online media. And what they found was, 38% of all the misinformation out there, all the conversations that are happening, had some connection to Donald Trump, right? And that's why you got this headline, that he's the single biggest source of misinformation. But this sort of backs up that study from Oxford, right? This idea that it's a top-down, bottom-up phenomenon, because of course we're spreading this misinformation ourselves. Now, the other number that came from this study that I think is underplayed is this one. Only 16% of all that misinformation was fact-checked, was corrected. So this is really a call to arms for us, you guys. We've got to raise that number, right? That's really important. Okay, another source of misinformation, and this is one I'm personally very interested in, because I'm a documentary filmmaker, and I think this is an under-examined source of misinformation. And this is those videos, right? These YouTube clips that are very slick, these little mini documentaries and fake documentaries, as I call them. And here's a really good example of that. This is that video that was circulating. Do you guys remember this one? This was that video that was circulating by America's frontline doctors, right? And you had, oh, by the way, the no, that's my editorial comment on this screenshot. This was that video. You had all these doctors, they had on their lab coats, of course, and they're standing on the steps of the Capitol, and they're spewing misinformation about hydroxychloroquine and other things. This got a lot of attention, right? This gets a lot of attention. Why is that? Why is that? Here's another example. This is an analysis that the New York Times did of that horrible fake documentary called The Plandemic. And I'm sure everyone is at least familiar with the name of it. I actually watched it, you guys. It's painful. It's painful. It's just, conspiracy theories strung together. But look at this analysis by the New York Times. And what they did is they're trying to get how much pop culture traction did this get? Well, they estimate that The Plandemic got more traction than The Reunion of the Office, this great show, right? More traction than Taylor Swift, right? This got a lot of traction. So why is that? Why do these documentaries, these fake documentaries, get so much play? And I think have a huge influence on public discourse. Well, here's a study that came out just this summer, and it found that just the fact that they're slick, right? The presentation style matters, right? You put together this slick package and it looks more credible. It may seem obvious, but it's important to note that, right? This creativity matters. I'm going to come back to that at the end. This slick presentation has an impact. Look at this study. This was a study that was done of, again, came out just this summer, where they showed these kinds of documentaries to health science students, right? So it was a little bit kind of a depressing conclusion here, you guys. Even for this audience, health science students, these kinds of documentaries were persuasive, right? They changed people's minds, right? Despite the fact that they're scientifically flawed. Now, you would think that this audience would have their critical thinking caps on, but still, these documentaries have an impact. So what kind of stuff did they show these students? They showed them stuff like this, What the Health, that Netflix documentary, and The Game Changers. These are scientifically inaccurate documentaries, but they have great sway, in part because they're incredibly slick, right? They have this compelling presentation style, so that's important. But the other thing that's going on here is the use of narratives, the use of testimonials, the use of anecdotes. And there is an interesting body of evidence that suggests that an anecdote can overwhelm our critical thinking, overwhelm our scientific thinking. And that's exactly what happens here, especially when you're using as an anecdote a celebrity or a prominent individual, right? It can really sway the way we think about an issue. And that's exactly what these documentaries do. The other thing that's going on here is people are selling stuff, right? They're selling products, they're selling ideology. And one of the best examples of that is this concept of immune boosting. And this is something that we're studying a lot at our institute, actually, because we think it's a really good example of this problem. And you guys know that the concept of immune boosting is scientifically complex, or scientifically iffy, might be a better way to phrase it. You don't want to boost your immune system, right? That's anaphylaxis, right? That's an autoimmune disease. That's something you don't want to do. but we're seeing this phrase rolled out a lot. And it's very, very confusing. You know, things that won't boost your immune system: yoga, chiropractors, homeopaths, naturopaths, herbalists, and Tom Brady. So why am I picking on Tom Brady? I'm originally from New England, so I bleed Patriot blue. It's a rough season, by the way. Tom Brady's at Tampa Bay now, so I can go at him a little more aggressively. But Tom is trying to sell these kind of immune boosting supplements. It's very, very frustrating, and he's getting a lot of traction, right? He's getting a lot of traction, and this matters, right? This matters. As I said, we're studying this, and we're looking at how immune boosting is being represented on social media platforms. I have personally looked at hundreds of posts on Instagram. Hundreds. This is gonna sound like hyperbole, you guys, but it's not. I've looked at hundreds of posts, and I haven't seen a single, not one Instagram post that is scientifically accurate in the context of immune boosting. It's just a whole bunch of noise. And in fact, we just published a study on exactly this with my wonderful colleagues. And we found that, you know, all this immune boosting is complete. The content on Instagram is almost completely devoid of scientific accuracy. A lot of it is commercial content, like the stuff from Tom Brady. And sometimes it's subtle. You don't realize it's commercial content, but it is. And the other thing that we found, and this is consistent with other research that we've done, is they often use scientific jargon in order to make it seem more credible. Like they'll refer to the microbiome or something like that. And that's important to know, because we see that in other spaces here, but it can be very persuasive. And there's interesting research to say exactly that. If you use that kind of jargon, you're viewed as being more credible. The other thing that we've done, this is another recent study. And by the way, this is a preprint version of it, but it just came out in BMJ Open. So it has been accepted. It's out now. In this study, what we did is we wanted to get a sense of what people would find if they were searching for immune boosting stuff, because that's exactly what people are doing. And there's research to back that up. And what we found, we looked at hundreds of pages, right, from search results, hundreds of pages, the kind of stuff that people would find if they were searching for immune boosting. And we found, looking at hundreds of pages, that in 85.5% of the time of those pages, immune boosting was portrayed as beneficial for avoiding COVID-19, which, as you guys know, there's no evidence to support that at all. So this is, you know, scientifically inaccurate and problematic for a bunch of reasons. But look at that last line. Less than 10% of the web pages that we analyzed had any kind of critique of immune boosting. And you guys, in our coding frame, we weren't even looking at, is this critique accurate or not? We were just looking, is there a critique there? And less than 10% of them had any kind of critique at all. So this is what the public is seeing, right? You guys know this, search engines create our reality, right? You know, the research tells us that people don't go past the first page. I think like something like 93% of people don't, and rarely, if ever, go past the second page of a search result. So this is their reality. This is what people are seeing in this context. Oh, and of course, there are a lot of anti-vax issues here. The anti-vax community is become energized. Again, this is something we're following very closely at the Institute. Incredibly frustrating. And I'm going to go through some of the data, what I think the impact it's having. But what I want to highlight here is the degree to which ideology is being used to push this concept. Early days. So this is some comments from anti-vaxxers in Canada. And I know this is happening in the United States also. The anti-vaxxers in the context of coronavirus or COVID really tried to position the arguments around ideology. So they would roll out ideologically appealing language like choice and freedom and liberty and consent. And unfortunately, we know that kind of strategy can work. The use of civil liberty language, these kinds of arguments, can allow people, as this quote notes, can allow people to sidestep the science, right? What becomes the focus point is the discussion of these civil liberty concepts and not the science. And unfortunately, we know that can be a very effective strategy and one that needs to be highlighted in order to get to the science. This is something that I'm very interested in. It's actually a topic I tackle in my next book. And this was a study on raw milk. And we by the way, we've seen this strategy used with fluoride. We've seen this strategy used by the anti-GMO community, and we've seen it used in the context of raw milk. where people are trying to, rail against the public health laws trying to stop the sale of raw milk. And in this study, they found that, those freedom of choice arguments get more traction than the public health arguments, particularly for individuals who are new to the argument. And that's really important, because I think in the context of the COVID vaccine, there are a lot of people that haven't been deeply engaged in the vaccination argument. And if their first introduction to this argument is the civil liberty arguments, they may find those persuasive. So that's important to remember. So here you have, Del Bigtree. I actually watched this video too, this webinar. It was so painful. I hope my presentation's not this painful. It was very painful. He talked about all the classic conspiracy theories, the role of big pharma, the idea that the vaccine is going to kill people. And by the way, viruses apparently detox your body. They're okay. The government is highlighting, is exaggerating the numbers, et cetera, right? Very common themes, but they also are playing to a particular audience, right? No surprise, they're playing to an audience. Now, this is an interesting study that was trying to explore the degree to which this sort of ideological leanings, right? A particular audience might be influenced by these arguments. And what this study found, again, a relatively recent one, a lot of really interesting research emerging right now, you guys. What they found is that people that voted for Trump were more likely to be concerned about vaccines, more likely to buy into conspiracy theories, to predispose to believe conspiracy theories. And one of the things I think I find fascinating here from this study is it was the conspiracy theory element that was more important than the conservative ideology. So these Venn diagrams overlap tightly often, but I think it's important to remember they're not the same, right? They're not the same. And that in fact, it is that tendency to embrace conspiracy theories that might be more dominant, despite the fact that that's also associated perhaps with right-wing ideology. Okay, so what's the impact of all this noise? You guys know this. I'm gonna do this really quickly. It's just good to remind yourselves about how problematic this is. It is incredibly problematic. It really, really is. There are deaths associated with this. There's hospitalization, stigma, discrimination. There's been property damage, people pulling down 5G towers. There's also been, and I don't think this is highlighted enough, this misinformation, I think, confuses health and science policy. We saw that with hydroxychloroquine, I think. But it also just adds to the chaotic information environment. And I used to say this didn't get enough attention, this kind of harm, but I think it's starting to, right? We're starting to see greater recognition of just the impact that this sort of information overload can have on people, especially when it's on social media. It really can make it more difficult for people to tease out what's real and what's not real. It can make people more likely to believe misinformation. But lots of tangible examples of harm. There's been arson, more racial tension, a lot of very interesting research going on in that space. There has been poisonings. And this was an interesting study. Again, we have to be careful, correlation, causation, but still they correlated hundreds of deaths and thousands of hospitalizations to one rumor around the use of alcohol as a cure or preventative strategy in this context. So real clear harms. And the other thing that's happening, I think we're starting to see this a lot right now, is this misinformation is starting to cause, adding to that COVID fatigue. It's inviting people not to adopt preventative strategies, and it's making people less trusting. So this was a survey, relatively recent, found that 23% of Canadians and 41% of Americans believe that the government is exaggerating the threat. That's bad news. The same study found that 57% of Canadians, and I think it was 61% of Americans, and there have been other studies that similar numbers have found that people are starting to relax. The survey was done, I think, early October, late September. So not good news, right? Not good news. And lots of studies now are starting to emerge that have correlated belief in conspiracy theories, embrace of misinformation with the reduction in preventative behavior, physical distancing, wearing masks, being responsible when you have symptoms. So really problematic. And then of course, there's the vaccine issue, which is going to become a bigger and bigger issue. I'm highlighting this study. I know it's old but I think it's interesting because I remember when this study came out in April, and it showed that 23% of Americans said they weren't going to get the vaccine. I was like, oh my God, 23%, that's terrible. At this point, a lot of us thought if anything, the pandemic was going to highlight, because this is what it's like without a vaccine, right? This is what it's like. And we all thought that this was going to cause people to understand the value of vaccines, but no, right? Even right out of the gate, 23% are saying no. And you guys know this, the numbers have just gotten worse and worse and worse. This is an interesting analysis, showing how people's willingness to get the vaccine has deteriorated over time. Lots going on here for sure, you guys, but I think misinformation is a big part of it. Now, there is nuance here, and I don't think we should ignore that. This is a study that came out very recently, done in late October, and maybe you guys are aware of this. It got a little bit of press. It found that if the efficacy is really high, people are more likely to get the vaccine, which I think is really interesting, because it shows that people are weighing benefit against risks, even if those risks are ill-conceived or are unfounded. People are still, they're still making that, and I think that speaks to the idea that there's the hardcore conspiracy theorists are still a relatively small group, and other people are sort of willing to listen. But even if it's 90%, right? Look, it's still only 64% of people. It's really depressing, you guys. The numbers are still not ideal. In Canada, I wish I could say the numbers were better. This is an interesting group of data where they did a study in July. They did one earlier, but I'm highlighting July and September. And in July, only 46% of Canadians said they would get, which is unusual in Canada. We have really high vaccine confidence here. Only 46% of Canadians said they would get the vaccine right away. And that has deteriorated in September to 39%. Yes, more Canadians say that they will ultimately get it. They're wait and see kind of approach. But I do think that this deterioration is a result of a breakdown in trust and the spread of misinformation. And this very recent study by Heidi Larson's group in the UK kind of backs that up. This study, it's still in preprint, but a good group. They found that exactly this, right? So it's good to have this data confirming it, that the spread of misinformation, the current spread, the recent spread of misinformation, is having an impact on the intention to get vaccinated. And the other interesting thing here, tying it back to that science exploitation, the use of scientific language, their team notes that that scientific sounding misinformation is having a particular impact. And I think that's important to highlight too. Before I move to what can we do about it, I do think it's important to highlight, because I hear this all the time whenever you talk about battling misinformation, the impact of the science itself is having on public perceptions. People are watching science for the first time. You guys have probably thought of this too. They're watching the sausages being made and they don't like what they see. They're seeing retractions, right? They're seeing scientists disagree. They're seeing, a body of evidence that isn't completely consistent, like masks, for example. That's how science works, right? But when people are watching this, it can reduce trust. And there's a little bit of evidence to back that up. We have this happening, of course, this concern that there is political interference. That's going to have an impact on trust. And then there's the polarization phenomenon. Now, I'm not going to go any depth into this study, but I do think it's fascinating just from a visual perspective, because it really does highlight the degree of polarization here. In Canada, by the way, it is a little bit, it is less, but it's getting worse. But this study is so fascinating because it just highlights, visually how liberals and Democrats and Republicans think differently, right? They just think differently. They talk differently about COVID, right? And that really highlights, and all of these three things, how science is being done, public trust, and polarization, is going to make fighting the infodemic more difficult. The other thing I think, it's something I'm personally interested in, I'm gonna say this real quickly, just maybe highlight it for the question period, is the impact that our long toleration of misinformation is having, right? We've tolerated pseudoscience too long. It's something that I feel very passionate about. Homeopathy was bunk before the pandemic. It's bunk now. It's going to be bunk after. We shouldn't tolerate it, right? Because what's happening now is that people are turning to things like homeopathy. They're turning to things like detoxes. They're turning to stuff that we didn't debunk robustly enough before during a pandemic at the exact time that we don't need to do it. And the other thing that is the exact time when we really need people to be clear about this stuff. And the other thing that's happening is this fascinating merger of wellness woo, right? This toleration that we've put up with, this wellness woo and conspiracy theorists. And the problem, of course, is that once you have that merger, right? Once these beliefs become part of your personal identity, it becomes more difficult to debunk it. It becomes more difficult to change people's minds. So that's one of the reasons it's so important to debunk misinformation right away, even if it seems kind of frivolous at the time. So here's a really interesting study, obvious stuff, and I'm highlighting it. I love this because it just sort of summarizes a lot of what I've said. It was a study where they looked at, the impact of misinformation around the world, and the impact of being susceptible to misinformation. What's the impact? Their conclusions, I think, are obvious, but it's nice to have the data, but it's also a nice sum of kind of where we are. No surprise, when people have trust in science, when they have higher numeracy skills, which was their proxy for critical thinking, less likely to believe misinformation, right? No surprise here. There's a link between believing misinformation and vaccination hesitancy and a likelihood not to adopt preventative strategies. And of course, the conclusion here, that we need better trust in science, we need more critical thinking. Okay, so what's the response? I'm going to do this really quickly. We need good science, obviously. I'm not going to go into depth into this, but that is so important. We need to be able to point to good, independent science. I hope that's one of the legacies of the pandemic, the value of good, independent science. I just authored a report for the Royal Society of Canada where we make this point, right? And I'm not going to go into any detail for this image, but the point of our report is how important good independent science is and how important it is to communicate that science in a way that the public can trust it. So government institutions need to do that. The funders, research funders need to do that. Researchers need to do that. The peer reviewers and the health officials need to do that. And of course, the media needs to do that also. There's a knowledge creation pipeline, and all along that pipeline, we need good science communication. Okay, the other thing we need, of course, is that we need the social media platforms to step up. The good news is they're starting to do that. Is it ideal? No, and we can maybe talk about that in the Q&A period. But they are starting to. You're seeing Twitter do it. We're seeing Facebook do it. We're seeing Instagram do it. We need more, but at least it's starting to happen. We need the regulators to step up. The FTC has done this. They've pushed out against these people pushing misinformation. The FDA is doing it also. We need way more. There was one study that found that only a very small percentage of the letters that have gone out during the pandemic have been focused on misinformation. We need more, but at least they're doing it, right? I know there's a resource issue, but at least they're doing it. We're seeing the same thing in Health Canada. I like this website. You can go to it if you see misinformation, something that's misleading, you can report it here. That's awesome, but we need more of it. We also need a healthy lifestyle. There's this really interesting research emerging around, and again, hard to study this well, so we shouldn't overinterpret it. But that healthy lifestyle, having a healthy lifestyle is one way to fight misinformation. When you feel better, you're less likely to be sucked into misinformation. And real practical bits of information like not allowing yourself to be exposed constantly to social media. Take a break from the noise. I'm not a mental health expert, so I don't want to spend too much time on this, but this is a really nice piece in the New England Journal of Medicine that came out in August that I think summarizes a lot of these issues. I think they highlight it's really important just to note that being stressed out is normal, right? But I want to highlight the second thing here that they, in this piece, they really note that we need to recognize the impact that just being constantly bombarded with pandemic-related news can have. And as noted in this nice piece in the conversation that came out in October, it really kind of summarizes my view on this. If we're just aware of our own cognitive biases, we're just aware of a lot of the things I've talked about in this presentation, that cycle that I've talked about at the beginning, we can have an impact. We can take control of our own news consumption rather than letting it control us. I know that seems trite, but I think there's good evidence to back that up. But of course, my main message here, you guys, is that we need to debunk it. We need to respond. And one of my first messages is debunking does work. Hey, it's in my title of my presentation. It does work. You know, when I say that to people, I say, we got to get there and debunk. You often hear people say, well, you know, Tim, debunking does more harm than good. It's this backfire effect. If you give people facts, they just become more entrenched in their views. I'm sure you guys have heard that. But in fact, the data on that is relatively weak. You know, and Facebook will use this as an excuse for not debunking. And that's a mistake. That's a mistake. If you actually look at the body of evidence, you know, my slide here says it's a myth. I don't know if I'd call it a myth, but this line, you know, the evidence on the backfire effect is actually quite tenuous. I think that's more accurate. You guys may know this, that a lot of this came from studies that were done in 2010 that were very context specific, and they did find the backfire effect. But almost all the research that's been done since then have either not found a backfire effect or found it to be very, very rare. So at a minimum, you know, my main message here is the backfire effect should not scare us away from debunking. And people might say, well, that may be true, Tim, but debunking stuff, another part of the backfire effect is that you might spread the misinformation. You know, you don't want to debunk something because then you're just gonna spread it. Well, again, the research on this is unclear. Ecker's group, they do a lot of research on this. This is from a preprint. They found this not to be the case. They found basically it is okay to repeat the misinformation when you're correcting it. So that's good to know too. Bottom line, don't let the backfire effect scare you away from debunking. And we do have a growing body of evidence to tell us that debunking works. You know, I actually personally did a big lit review this summer, came to the same conclusion that this group did in their meta-analysis, that there's cause for optimism. The vast majority of interventions do work, you know, at least somewhat. Now, what we're trying to do here is move the needle. It's not a magic wand. It's not going to fix everything, but it is an essential tool, especially if it's done by experts, like people on this call, people involved in this event. It's so important. We can have an impact. And the other thing we want to do is we want to debunk at the right time, right? We want to debunk quickly and in a targeted and in an evidence-based manner. And the 5G story is a good example of that. It's one of the reasons I started the talk, you know, referencing the 5G conspiracy theory, because studies have shown, this was a study exactly on it, where these authors speculate that we kind of ignored it. You know, it seemed absurd, right? We didn't get on it right away. And they suggest that a combination of a quick and targeted intervention might have stopped that spread, right? And that's the other reason I raised that Canadian conspiracy theory. There was a quick and targeted intervention, and I think I'll have to go back and look at this again. But I think it did work. I think it did kind of stop the spread. And here's an even more recent study that came to that exact same conclusion, right? That if you have a quick targeted intervention, especially if it's done by experts, by respected individuals, we can have an impact. And in fact, these researchers say it's one of the major differences of that intervention being successful. So, okay, so what does a good debunk look like? What do we need to do? Well, it's not going to surprise you. First of all, as this headline says, yes, it's worth arguing. I don't know if I'd say arguing, it's worth responding. This study came out last summer. I really like it because they use a bunch of different methodologies, but basically they found really straight ahead, you guys, you provide people with the good data, the good science, and you highlight those rhetorical tricks that are used to push the misinformation. This is a conspiracy theory. They're using ideology in order to get across, you know, to trick you to not look at the science. They're using, you know, anecdotes, you know, they're misrepresenting risk. Do that, right? And you can have an impact. And look at this. This study also found no evidence of a backfire effect, even amongst what they call the most vulnerable groups, which are in the United States, apparently US conservatives. So very, you know, kind of interesting. So here's my list. My list, you know, you can screenshot this. It's not comprehensive, by the way, but some of my favorite tips for effective debunking. So provide the science. Yes, it works, as I just said. Use clear and shareable content. Think about what this is going to look like on Twitter and on Facebook and on Instagram. Use trustworthy and independent sources. Now, I know that's tough, right? You know, because people are going to say, I don't trust World Health Organization. But number 4 can help here. There is some evidence suggests that if you point at the consensus, this is what the body of evidence says. Yes, there's conflicting data, but this is the body of evidence. You can have an impact, right? And this is data that was, the research that was done in the context of vaccines. They've also done it with climate change and GMO work. Pointing to the body of evidence can have an impact. You also want to be nice. You want to be authentic. You want to be humble. There's actually differing evidence on this, but I think most of the evidence suggests that if you're nice, if you're humble, you authentic, you're not just a talking head, people are more likely to view you as being credible. Number 6, really important. Hey, I told you these documentaries are persuasive because they use narratives. Let's do that ourselves. Let's, as I say here, creativity wins. We need to use creative strategies to get across the good science. We need to use narratives and testimonials and art and humor in order to get across the good stuff. The other thing that you need to do is, as I said, highlight those logic gaps, those rhetorical tricks. Make the fact, make the truth, the thing that's the hook, the thing that's going to be most memorable. And number 9, so important. Now, this is important for your own psychological health, by the way, if you're going to dive into the debunking game. Always remember the general public is your audience, not the hardcore denier, right? Don't waste your psychic energy on those hardcore deniers. This is a great example of that. Look, we're not going to change these people's minds, right? We're not going to change their minds. This is part of who they are. This is their life. This woman who's holding up the medical fascism sign is not going to listen to the facts, right? So this is a great document from the World Health Organization that really makes that point. How do you talk to these hardcore deniers? And they say, don't waste your energy on medical fascism, woman. But what we can do is we can use our discussions with them to talk to the general public. So you might want to use an engagement with a hardcore denier as an opportunity to talk to the general public. Rule number 1 from the World Health Organization: the general public is your target audience, not those hardcore deniers, whether you're talking about masks or vaccines or whatever. And use the good science and highlight those rhetorical tricks that are used to push the misinformation. So the last bit of advice I want to give you guys, this goes to breaking that cycle. So this was research done by my colleague, again, Gordon Pennycook. He does really cool research in this space. And he found, this was done on Canadians, but I think it applies to most people. People want to be accurate. They don't want to spread misinformation. They don't have nefarious goals, right? They want to be accurate, but the social media space is just so frenetic. It's so noisy. They can't stop themselves from spreading misinformation. They're stressed out. So his research found that if you can just get people to pause, right, to be calm for a moment, sort of to embrace a culture of accuracy, they're less likely to spread misinformation. So we can just nudge people to pause, we can have an impact. Now, I know that sounds ridiculously straightforward, but Gordon's work has been replicated by others. Some great researchers in the United States have found the same thing. So this is an actionable strategy, right? And so we've tried to implement it. We worked with Media Smarts, they're a media literacy group in Canada, where we started a campaign to get Canadians to do exactly this, right? We call it check, then share. You can go to this website, you don't need to pause, go do it immediately and share this content. Because we think that if we can just get people to do that, we might move the needle. We might get people to slow down. So our big plea is check first and then share after. So with that, and by the way, here's the cover of my new book in the United States, which comes out next month. With that, I'm going to say thank you very, very much for this opportunity. I really do appreciate it. I appreciate everything that Philadelphia has done for the world over the past few weeks. So thank you very much. And before we get to the questions, I'm going to end with my 2 favorite words: go science. So again, thanks very much, guys.
Well, Tim, thank you for just an absolutely spectacular talk. You delivered essentially just like I knew that you would. I'm just so impressed by how contemporary your talk is, how it really is about the science that's just come out in the last few months, yet with an appropriate word of caution about preprints and realizing that it's still so very new. but also just so charismatic. And then just your points at the very end there about how even though we'd be so tempted to go after that denier, that hardcore denier, that's probably not the person who we're going to be able to change their mind, and that we still probably have that obligation and should be those good messengers, even though we may not be able to change the mind of every target in front of us. So normally when I moderate these sessions, I take the prerogative of asking the first question, but we have so many, I'm actually not going to do that, and I'm going to save my question for last. We also have a very active health communication research group within our college, and I know that several of them have chimed in as well. So the first question that's been posed to you, Tim, is: are there certain groups that are more susceptible to misinformation aside from Republicans? And if so, which groups and what has been the impact on them?
So I think the answer is yes, and the scholars involved in this event are going to know this too. It is very complex, right? There's not an easy answer here. People who believe misinformation come from a wide range of demographics. So we have to be careful not to point our fingers at a particular community. And there's been interesting research around a vaccination hesitancy, as I'm sure people know, that have shown that it's even people in the upper socioeconomic strata are believe misinformation. There's even a study about people with undergrad degrees in college education. So we need to be careful not to cover any community with a single brush. In addition to that, and I think this is really important, we're seeing this playing out with the vaccines, and certainly in Canada, are issues of trust. There are certain communities that have completely justifiable historical reasons for not trusting particular voices that are playing in this role. And in Canada, Indigenous community, for example, and I think it's incredibly important to engage that community in a way that is meaningful and allows them to be part of the conversation about getting over the misinformation. I think that is I think very, very important. So yes, having said all that, there are definitely communities. There is a correlation. Gordon's actually done research on this too, between people that don't have good critical thinking skills being more likely, more susceptible to misinformation. That may seem obvious, but it's good to know. The reason that's good to know is because there's also research that shows that teaching critical thinking skills can have an impact. There's also interesting research emerging right now that shows that there are certain individuals that are predisposed to conspiracy theories. And I still believe that this is a relatively small cohort, but those people can have a big impact on the broader community because they often are very loud voices. So these are often individuals with particular kinds of psychological leanings. And I want to be careful because I'm not a psychologist, so I don't want to interpret the research robustly myself, but I think that exists. But I think what's important to note is that those individuals, I think of often, and we've seen this with the 5G example, they can have an impact on the broader public discourse. Because, we see those at the beginning, I put those numbers where it seems shocking. 50% of the population believes conspiracy theories. I don't think that belief is very deep. I think what we're really seeing is people saying, I'm willing to believe that, right? I'm open to that when they're answering those surveys. Surveys are inherently flawed methodology. Everyone knows that. So I think that's more what those methods are displaying. So long answer. I'm going on too long. I'm going to end with this. One of the most important things to do is listen, right? It's so easy to say, "Oh, you're crazy. I can't believe you believe this." I actually think listening to people is so important. People often just have genuine questions. In fact, the last word in my vaccine book, the Vaccination Picture, where I sort of tackle vaccination hesitancy, is listen, because I think that is so important.
So taking that issue and I guess turning it upside down a little bit and thinking less about who we're trying to communicate to, but more about us as communicators. One of my colleagues asked, how do we advance the evidence base without coming across as academic elitists? I've seen folks talking about academic talk when trying to debunk misinformation, and it's not well received. So how do we not come across as eggheads?
Yeah, I think this is incredibly important, and I'm pointing over here because I got an argument with my neighbor, and I actually thought we were friends. It kind of broke my heart a little bit. So he's a hardcore conspiracy theorist. He's bought into everything, and he started. He was enraged too, right? So I think my football conversations with him are not going to happen anymore. He said exactly what you just said, David. I can't trust academics. They come across as eggheads. I think that was actually the term he used. And again, I go back to we have to listen. So I think what we need to do is package the facts. I don't think we should water them down. I think this is really important because one of the critiques you could say is, oh, we shouldn't fight anecdote with anecdote. We shouldn't fight narrative with narrative. We still need to use the facts. And I agree with that. But we can use narratives and things that resonate with people to start the conversation. And there are people that have done that. And there's been really interesting research done in the vaccine space that have found exactly that, right? That you use the good evidence, but you start with a story from other parents, that you start with a picture, an image of what the disease looks like. So there has been interesting studies that have shown that, using those kind of strategies can work. And the other thing that I try to do is use artwork because there's interesting research that talk about, use artwork. People come to it more neutrally. They come to it more openly, and that's an opportunity to start talking about the evidence. Now, having said all that, I still think we can make good, digestible content on social media that can have an impact. And one example, is the World Health Organization's COVID myth website. They have created great infographics that are evidence-based, and we try to do it ourselves. If you go to our website, we have some similar content that is evidence-based but still shareable. So that content exists, and I think we all need to learn how to make it ourselves.
So you would, and I think you touched on this at the very end, and this dovetails off a question from one of our communication science faculty. So it seems like you would really advocate then that we get out of the habit of, and as you showed to us in your talk, we get out of the habit of using the cobalt blue screen with the yellow font or the yellow type,
Yeah.
and we really try to come up with well-packaged, maybe I'll even use the word slick videos and presentations that really obviously are true to the science base as well.
Yeah, and it's. I think it's doable, and how about creative? Let's not say slick. Let's say creative. I think it's doable, and that I refer to that Royal Society, and now I'm curious if the audience agrees with this, so I'll put this out there. In that Royal Society report that we just published, came out late October, end of October. We make as one of our recommendations, we actually suggest that it's an obligation for academics to correct misinformation when they see it. Not everyone's going to agree with that, but we frame it in the context of their discipline, right? So if they see their work being misrepresented and misrepresentations that relate closely to the work, it's almost an obligation. I can't remember the exact wording. I should have shared it on the talk. So I think given the impact that misinformation is having, given this misinformation era that we live in, I really think it's important for academics to engage. Now, having said that, I think it's equally important for institutions, so universities, research funders, governments, to support academics to do that. And that means giving them the resources they need to do it, the time they need to do it, and rewarding them when they do it. Also, I think this has to become one of the almost the jobs of academics. Now, not every academic's going to want to do it, but if we can just get a few more people engaged, I think that'd be a huge win.
Yeah, I completely agree with you, and I do wonder if we aren't at the beginning of a sea change when we think about just academic metrics and evaluation of academic success, if in fact we may not see that 5, 10, 20 years from now, we really are evaluated not just in terms of the number of publications that we produce, and not just the impact factor of the journals that they're in, but also how effective have we become in taking our messages to the public? I mean, this is something that in a College of Public Health, we talk about a lot, that how do we really change the health and well-being of our neighbors in North Philadelphia, other citizens of the city, throughout the state and throughout the country. And our impact needs to be more than just, we got 10 people to read our journal article last month or in the last year. So
yeah, I agree with you. I think that this, and I'm seeing the change. You know, when I first started, I've always done a lot of outreach, and I don't want to say it was discounted or wasn't taken seriously, but you know, even other academics are sometimes look down on that behavior. That's changed. I think that's changed. I think people increasingly recognize how valuable it is. And again, I want to emphasize, not everyone is going to enjoy doing it. I get it, right? Not everyone enjoys, you know, particular kinds of teaching. Not everyone enjoys being in the lab. You know, everyone has different. Not everyone's going to want to do it. But I do think we need to get more academics involved and also reward them. And by the way, I also think this goes for basic science. You know, I think that educating people about basic science, about lab stuff, that's valuable too. I mean, we need to create a scientifically literate society, and I think that this is all part of it.
Yeah, I completely agree. So back to the conspiracy theories. One question that was posed was that a lot of the people who believe in conspiracy theories now seem to be moving to social media like Parler, and you know, you've probably seen that there's already rumblings of, you know, Trump's going to create his own news network, and Lord knows what that would create. But so how would you recommend that we go about debunking when those platforms really aren't on the mainstream? And what do you see as the potential damage of those platforms?
Yeah, this is. I actually think that this is part of a broader conversation about how we deal with the spread of misinformation on these platforms. I think this is going to be one of the great challenges of our era. You know, it is fascinating because there's constitutional issues here. There's freedom of expression issues here. You know, it's interesting because a lot of people think I would be, you know, super aggressive about these platforms shutting down what people are saying, Facebook, Instagram, Twitter. But we have to remind ourselves what we're asking. We're asking a private actor, right, to make a decision about what we're going to see. And while I do want these platforms to stop the spread of misinformation, I think we need to be really careful what we're inviting them to do, right, in a liberal democracy. But yeah, the rise of these other kinds of platforms are incredibly challenging. And by the way, my neighbor brought up these platforms, you know, and if you don't go to them, you're kind of viewed as not being credible. They believe you don't have the whole story, right? You know, well, you're part of the conspiracy if you're not looking on these platforms. So it's problematic on two levels. I wish I had an easy answer. I do think we need to monitor what's going on there. I do think we need to have a sense of what's being said, and that we try to debunk it more broadly. And hopefully the broader, the more popular social media platforms can still be a forum where we can speak to the general public, as the World Health Organization suggests, right? It still invites us to make that as the goal. But I definitely think we need to monitor how these platforms are playing out. And as you know, a lot of these videos have, you know, the pandemic, I think, migrated to one of those platforms. So it is a real challenge. I'm sorry, I'm going on and on. My dream would be an international independent body that was completely transparent, that could monitor this kind of activity. That dream's not coming true, but the mere fact that I'm thinking about it, I think, points to the kinds of regulatory actions that we might need.
Yeah. So along those lines, and I'm smiling at this next question because it actually part of it echoes back to my early graduate school years. But can you comment a little bit on the usefulness, if not the safety, of studies where a researcher like you or members of your team might embed yourselves within a conspiracy or denialist group movement and then write about what you're seeing?
Yeah, I think it's so. There's interesting research ethics issues about that, which I'll set aside, right? But that is kind of raised some interesting questions, and we've seen that when people go into patient groups and write about their experience in patient groups, and we have done research, for example, where we've gone into Reddit streams, and we actually just published a study in the context of non-invasive prenatal testing where we did that. I think it's very interesting because it goes to this idea of listening and getting a sense of what is going on. And as you know, David, I find it interesting. I try to do that with my own personal work. Like I try to go to all the alternative therapy. I think I've been to every single kind of alternative practitioner out there, and it was an incredibly good idea to do that because, you know, David, I mean this. It was almost always a positive experience. It was almost always. I get it, right? So when you go to these places and you listen to the conversations, I think it helps you understand why people may believe these kinds of these bits of misinformation. I think it does raise some really interesting research ethics questions that, and I know that the research ethics bodies are actually trying to adjust. In Canada, our new research ethics guidelines are going to try to tackle this. But I think it's important to listen to what's going on in these places. I'm not sure if that's what this question was getting at, but I think it is valuable.
No, I think it is, because I do see the challenge. I mean, there obviously a research ethic perspective, but as you alluded to, by going and seeing those practitioners, by crashing meetings where, well, crashing maybe not the right, attending meetings where you might be the dissenting opinion or one of the few dissenting opinions in the room. I do think it gives us some insider understanding, and I think your point is very well taken. That unfortunately, while a lot of the things, particularly in the wellness industry, are overhyped and overpromoted, not all of them are necessarily harmful yet dangerous. They just may be misguided, and you could see, unfortunately, why people would be lured to that. And to that point, the next question actually comes from one of my students who was asking, what are your thoughts about either the FDA or Health Canada stepping in to regulate the wellness industry the way they do big pharma?
So I would love to see more regulation. I would love to see if and I'm involved in conversations right now with Health Canada around this, because we're revisiting homeopathy. I think I can say that. I don't think that's secret. But I would love to see more regulation. But we can take a step back, because I think at a minimum what we need is to have more accurate information that's portrayed to the general public. So in Canada, that's the Competition Bureau and the FTC in the United States. At a minimum, I think that we need to market more carefully the kinds of claims that are made about these products, because who's against good information, right? Because often alternative practitioners use autonomy and choice as a justification for their practice. So let's put that back, right? Let's hold the mirror to them and say, if that's true, then what we need to have is accurate representations. But bottom line is, I would like to see more aggressive regulation. I'd also like to see the professional health regulators be more aggressive in this space. So in Canada, it's the colleges of physicians and surgeons, the associations monitoring nurses and physiotherapists. I think they give way too much of a pass. And this goes back to what I said before about sort of tolerating pseudoscience. I think that they have a very strong responsibility, especially in this era of misinformation, to stopping their members from spreading misinformation, whether it's about an unproven stem cell therapy or whether it's about an IV vitamin therapy. I think we do need to be more aggressive, and we start with making sure that the representations are accurate.
So how much do you think that we as researchers also hurt ourselves because we are sometimes reluctant to say that research findings are factual, or that a body of work has proven something? And do you think that some of our own reluctance to be as certain or as confident as we could be in our beliefs contributes to the general public not believing in the science?
I do, and I think that is a really that question with a bunch of layers to it.
Yeah.
Because you're right. Gwyneth Paltrow can say, this jade egg works, it's amazing, right? Everyone should use this jade egg, and then the response might be, and I've actually heard this response, well, we don't know, we haven't seen the clinical trials on the jade egg, and
right.
We need to see what the actual impact might be. And I do think that reluctant, but I'm of two minds, because we also don't want to be dogmatic when the science doesn't back it up, because if that is going to backfire, and you can see it backfiring, right? So I think what we need, and I think we can do this, and I hope in my own humble way, I've tried to do this in some context, we can still be engaging and assertive while still representing the science accurately. And I think masks are a really good example of it, right? The science around masks is still evolving. The science around masks is still largely observational, combination of observational studies and lab studies. But you take science plausibility, you take the emerging evidence, and you also take, I don't think this should be underplayed, the symbolic value of this, right? And it clearly equals, masks is a good policy, right? And I think you can say that in a way that is honest and transparent about the science. It still sort of gets traction, it still has value, but doesn't dilute the ultimate message. And some people are really good. Jen Gunter is really, a colleague of mine. She does a great job of it. Sometimes she uses language I wouldn't use, but there are science communicators out there that do a great job of exactly that.
Yeah, and it's interesting that you bring her up, because I know that I agree with you. I think she does a fantastic job, but I've also seen her be criticized by other medical professionals when she gets a little bit, I'll say, off color with her language, or a little more casual and non-scientific with her language, even though that for much of the audience, it may be more effective than being, I'll use the term egghead again, that being super scientific and super eggheady.
Yeah, I think, Jen is an interesting example, and there's others we could use, right? I think that, play to your strength. I could never get away with using the language that Jen uses. I just couldn't. You play to your strengths, and you figure out, what this is kind of a cliche word, but you find out what your voice is, right? And then use that. And there are other people, and we've definitely seen this with in the context of COVID, where you have these public health authorities that are very straightforward and somber in their presentation style, and it's incredibly effective, right? Because it's authentic, right? And so you don't have to be, you don't have to be zany or anything like that. I think being authentic, and there has been some research on this idea of being authentic, and you can do that many different ways. And I think that's why in Canada we have some great public health officials in our own province in BC. It's because they come across as people, as human beings, right? And that, I think, is a lesson that is going to have an enduring impact, I hope, after the pandemic.
And it's impossible not to think about how everything that we've seen from Anthony Fauci over the last several months, and the tightrope that he's obviously had to walk, and the challenges. I'm sure if he ever wrote one, it would be an absolutely fascinating book. But I know personally, I've been so impressed by both how he's, played played kind of the straight man, if you will. And then at other times you've seen snippets of what's obviously his frustration and his disappointment in what has happened, and how we have not responded, and how unfortunately so much of his advice has not been heeded and followed. And yet I can only imagine how thin his patience must be at some point. So related to,
and we have the same thing. We have a public health authority here and she's doing a fantastic job. But it's the same thing. She has to walk this incredibly delicate line between here's what the science says and here's what the government wants. But they do it. And I think one of the reasons that the public responds is because sometimes she does relate it to herself. Listen, I have kids. My kids want to go out on Halloween. Those kinds of little things I think matter, and they resonate.
So do you think that it's going to be possible for us, as we deal with the pandemic, to either stop or overcome the politicalization of science, and where do you think we're going to come out on the other side?
Yeah, now the politicization has been particularly bad in the United States. We not as bad in Canada. What's really interesting is the people have been critical of in Canada, politicizing in Canada, have adopted some of the American language, which is kind of interesting, right? Because they're probably circulating in the same communities. I think that what we, and this is something that we tackle in our Royal Society report, which I'm going to tweet out, by the way. I'll tweet to Temple after this. It's a trite response or an obvious response, but I still think it's important. I think it really highlights how valuable independent science is, right? And having this independence And I think we saw it in the United States when people were talking about the pushback. But this isn't an insignificant. It's maybe obvious, but it isn't insignificant when you see researchers under increasing commercialization pressure, for example. When you see researchers under increasing even translation pressure, right? We need you to translate in this way in order to get this grant, researcher. Those kinds of things are read by the public as an agenda, right? And our own research has found, we did this research in a different context, in the context of genetics, but we have found that those kinds of stipulations can cause people to have less trust in the science. So having truly independent science, and yes, I know that's very hard. Science has always been under a whole bunch of pressure, right? With Cold War pressure, right? Military pressure, there's always been under pressure. But being transparent and as independent as possible, I think, is the antidote to that politicization, at least at the production stage.
Yeah, I think your reference to the Cold War and also just scientific pressure reminded me of a book I read several years ago called The Winter Fortress, which was all about Germany's race to develop an atomic bomb and what they were doing with a water facility in Norway and how it ultimately gets sabotaged. But one of the underlying themes of the book is how the scientists, both on the German, but also on the American side, were under so much pressure to deliver an atomic weapon under what was an incredibly short period of time, probably no different than the pressure that the major pharmaceutical companies are feeling right now, realizing that everyone is looking to them to get us a safe and effective vaccine as quickly as possible. We have to trust in that, and we hope we can trust in that vaccine. But we also know, many of us know, that if big business starts cutting corners, sometimes not such good things happen. And so I can only imagine what the pressure must be like for the scientists in those companies who are obviously trying to do right by, whether it's by the worldwide population.
Yeah, the pressure is incredible. And what we need transparency. We need good science. We need transparent regulatory process, and we need good science communication. That's what it's going to take. And that last element, of course, the theme we're talking about here, so important. A vaccine only works if people take it, right? And
right.
so important. And hopefully we're going to get on that right away. It is interesting in the scope of human history. There haven't been that many times when big science, like go do this, right, has succeeded. We have, there's the Manhattan Project, there's the moon shot, which was not, a smooth path. There's this, even the Human Genome Project's a little bit different because, did we, there's an open question about how successful it really was, right? When you talk about therapeutics and, the revolutionizing. But so this is a really interesting moment in history. So from a scientific history, see how it all plays out.
And I'm glad you mentioned the moonshot. I read one of those books last summer, which seems like a lifetime ago at this point. But I remember at points in reading that book, seeing the pace at which the NASA scientists were working and the pressure that they were under to compete with the Soviets. And, it almost took your breath away thinking, how are they going to do this? And the millions of dollars and the lives that were at risk if it went wrong. And it was really, you could almost feel the suspense as you were reading the book. And, it's not often you read science and have suspense at the same time. So Tim, as we wind down our time with you, I have two last questions for you. One, we have a lot of students on the webinar today, which I think is fantastic, both at the undergraduate level who are majoring in our programs in the College of Public Health. But then we also have a number of people in our Masters of Public Health and our doctoral programs. And looking to the future, what are your words of wisdom for them about the role that they should consider playing in debunking scientific misinformation and being good stewards of science, regardless of the discipline that they focus on?
Well, first of all, I think again, let's start with some good news. Because of the work that I do, I'm seeing more and more student groups taking, David, a leadership role in fighting misinformation. they're tech savvy. They're doing creative work on Twitter, on YouTube, on Instagram, and so you guys are our future. We need you guys. We need you guys out there. And I'm involved in a national misinformation initiative in Canada that the federal government is involved in, and the students are really teaching us, right? So I should be listening to them about communication, because the emerging platforms, right? TikTok, you name it. So but I will say this, don't shy away from getting involved. Become part of the conversation, both on an individual level, but on a broader level. And the other sort of real practical bit of advice I can give, because some people don't want to, they don't want to be tackle everything. If there's a topic that you find interesting, just do that. Just tackle that one little tiny thing. And my favorite example is there's a Twitter feed, and all this Twitter feed does is call out media reports that are really just animal studies. They're just mouse studies. And that's all this Twitter feed does. And that is so, so valuable. And I think it has now over 100,000 followers. It's all it does. And I think it's called Just in Mice, or Just Say Mice. I think that's the name of it. Because all it does is say, here's broccoli cures cancer. And it was a small study of 3 mice, right? So all this does. And that is incredibly valuable. I've seen that Twitter feed referenced in broad media reports. So find something really that you're particularly interested in, and just become, this is what you're going to debunk. When you see this, I'm going to tackle this. And maybe it's going to be an Instagram feed. Maybe it's going to be a Twitter feed, or maybe you're going to do tiny YouTube clips. There's so many things you can do. And the other thing, you guys, is I'll say this, it is really fun. You can be creative. It is a very rewarding thing, but you also need a very, very thick skin. So, start growing that now.
Yeah, I love the Twitter feed about the mice. You and I, and probably others on the call, are old enough to remember the original cast of Saturday Night Live, and when Chevy Chase did the news, and very famously said, in today's news, white mice cause cancer. So my last question for you, and we can file this away under the shameless plug department. Tell us a little bit about your book and how you decided to focus on anxiety. It's being released, so it's available in Canada, but it's not available here in the US through Amazon till December 1st, right?
That's right. And as I said, it's weird. I don't know why the publishers did this. In Canada, it's called Relax Damn It. In the US, it's called Your Day, Your Way. Thank you for the opportunity for a shameless plug. But really, the gimmick of the book, David, is it's an entire day, like waking up, going to bed, drinking coffee, peeing. Do you put the seat up or down? That's an important question. But the whole point was that every decision that we make throughout the day is influenced by misinformation and twisted ideology, right? Every decision we make. And I tackle like fun stuff. Like there's actually studies on whether you should leave the seat up or seat down. And there really is studies on that. But more controversial stuff like letting your kids walk to school, commuting. Every decision we make. And I hope that it has sort of resonance, because it really highlights how these big problems that we're having about misinformation and vaccines, for example, those same forces influence all of us, day to day.
Mm-hmm. Yeah, it sounds fantastic. And, I also couldn't help but think, as you were saying that, about the number of people who have remarked to me, and I'm sure you've heard the same thing, that as they've gone back into the office after being at home for a period of time, or if they've gone out in a public place, they can't help but think twice when they grab a door handle, or they touch a surface, and they begin to think, uh-oh, did I just touch something that could have been touched by somebody who's COVID positive? And is this how I'm going to contract the virus? And I've had people tell me that, being in the office and touching door handles is very anxiety provoking, whereas a year ago, they never gave it a second thought. And I think you're absolutely right that there are probably numerous decisions that we make that interact with our health, but also introduce a great deal of anxiety. So, it sounds like a great book, and I can say to others who haven't read any of Tim's books, they are informative and yet incredibly engaging. and entertaining reads. So not only would I recommend that we all take a look at this new book, but also look back at some of his titles, which I think, as he alluded to, that when he's gone and attended meetings and tried some of these products, it's been fascinating to hear what that experience has been like. So, so with this, I want to thank you again, Tim, for setting aside, some of your time today. We would have loved to have had you in person. I'm sure, if the election results had stayed the same and yet we didn't have a pandemic, I'm sure it would have been a particularly great week to be here. We would have taken you to Four Seasons Total Landscaping. It's actually not that far from the campus. But I want to thank you again for your time today. I think this has been an absolutely fantastic session, and obviously best of luck to you with the book going forward. And for those of you who are on Twitter and not following Tim, he's an amazing follow. He's incredibly active. So I strongly encourage you to add him to your list as well. So thanks again, my friend.
Thank you so much. Too kind. Good luck to everyone. And come on, Eagles. What's going on?
Well, we're going to end up winning the division. So
True.
Thanks. All right. Take care, everyone. Have a good weekend. Bye. Stay safe. Stay healthy.